cold spray. Little pinch here, a couple of seconds. Once we get that skin kind of numbed up from the cold spray.
Okay, sis, don't look.
Here you go, just a little pinch, a couple of seconds. That will get the skin numbed up there. You doing okay?
Yeah.
Good. Most people said the cold spray is the worst part of this whole procedure.
That's what she said.
Yep. Now, we're going to do the same over here on this side. Comes that cold spray. It is so cold that the hairs on your toe will actually frost up.
Yeah, let's have you crystals.
Mm-hmm.
You doing okay, sis?
Yeah.
Okay.
That's the worst part, isn't it?
Yeah.
Now what we're going to do is just slowly numb your toe up. Starts hurting too much, tell me to stop. Okay? It's not the needle that hurts, it's the fluid going in again. Any pain at all right now?
No.
No? Good.
Yeah, that lidocaine is always pretty uncomfortable.
It stings and burns a little bit. It's also the pressure of the fluid going into this area.
How many of these do you think you do a day?
Good question. I've done 3 this morning. Yesterday I did about 5.
Wow.
And then the day before that I did about 4 or 5. So how many of these done am I so far? I would say I've probably done 6,000, 7,000.
Impressive.
The key to these is going slow. I see a lot of people try to numb a toe very quickly. That's where the pain comes from. If you go slow and easy, it's not so bad at all. And if the cold spray is the worst part of the whole deal, that's a good deal. All right, my dear. Now, I also use a lot of local anesthetic. It's not that you need it. You can usually do this with 3 or 4 cc's of this fluid, but I usually use double that amount. Yep.
It's a fluid.
And that's the reason why. I put a lot in here, because that way your toe will be numb for a good, probably 12 hours to 24 hours after this is done. So just understand that the local anesthetic is working. You got to still take it easy on it. But to me, if it's my toe, that's the way I do it. In fact, I did my own toe. And that's how.
Oh, jeez.
You did it yourself.
Well, in school, in podiatric medical school, you have to do your shots to yourselves as well as to your classmates. Because that's the way you learn. You know what it feels like. What I'm doing is putting it in the same spot where I gave you the shot already. You don't feel the needle, do you?
No.
No, good. What I'm going to do is, again, inject nice and slow. If it starts hurting or burning, just tell me to stop. When it eases off, say go ahead again and we'll go again. This is kind of the most humane way to get your toe nice and numb. When your toe is red and inflamed like yours is, you have to use a lot of local anesthetic, because if you don't, you may still feel it. So you have to really sort of overdo it is better than underdoing it with the local anesthetic in a toe. Any pain?
No.
You're doing good, sis.
Good, you're doing great.
You're tough.
Most of the toe is numbed on the top. The side's already numbed. If you go slow, it's really not bad. The youngest I've ever had to have done this for is a 4-year-old.
Oh, wow.
As far as letting me do it and doing it this way, I've had to do babies too. But a 4-year-old didn't even cry. So it can't be that bad as long as you go slow.
Yeah.
Now, the top of the toe and both sides are already numbed up. Okay, I still got to make sure we get enough numbing medicine down here on the bottom. So what I'm going to do is touch you on the side here with the needle right over here. Let me know if you feel anything sharp. Okay?
Okay.
If you don't, you're going to be numb, and I'm going to go ahead and put it in and get you injected, get numbed up. Any sharpness there? Any pain?
No.
Good. See, it's already numb. So the needle's back in. We're just going to slowly numb up the bottom.
never really had bruises from where the needles come in.
Because the local anesthetic actually is a little bit acidic, and that's where, and with all this fluid in here, it's actually pushing the tissues apart. When you push the tissues apart, it breaks little blood vessels, and that's what causes the bruising. The bruising from these procedures, even when I do surgeries, bigger surgeries, most of the bruising I get is not from the actual surgery. It's actually more from the numbing medication that I use, oddly enough.
You've never been bruised up too much, sis.
When I was little, I had, though.
Well, I'm talking about from having this procedure done. You've not ever been too bruised up.
And you'll see how the toe's getting kind of purpley colored. And that's normal. That's the local anesthetic working, and it's also somewhat what we call a tourniquet effect, with all this numbing medicine and pushing your toe. Some people panic. They say, oh, that's too much numbing medicine. Well, to me, if it's my toe, I want it to be numb as long as possible. That's what we do. We've got about 7 cc's of fluid in there. That's a lot of fluid around the toe. But it will numb it up really well, and that way we have the best success at numbing this up before we go messing with it. Now that it's a little bit more numb, I'm going to put a little bit of a gauze around the base of your toe, and then I want to scrub up that toe just a little bit better to try to get some of that bacteria count down on that toe. Looks weird, huh?
Feels weird.
Feels weird? That's
She's
good.
wiggling it around.
That's good.
Now, you came up with this tourniquet technique, didn't you?
No, this
oh,
is
you didn't?
That some people
I thought
believe
you
in,
had said
others
it.
don't. The research that I look at shows about a 5% improvement in your
Right.
success rate with this procedure when you use the tourniquet. So I like to use that. If it gives me 5% more better, I'll take it.
Yeah.
The success rate of the procedure is usually around 88% to 89%. Without a tourniquet, with the tourniquet, it jumps up to around 92 to 92.7 is the numbers that the one study that I cite that works pretty good. So I think that and that's pretty consistent.
Right.
Some people just don't like the tourniquet; they'd rather everything drain out. The chemical that I use, I have to use more chemical if I don't use the tourniquet. And the less chemical, the less trauma to her, the better off she is.
Right.
We want to do enough to get rid of those edges, but not enough to. We want to sniper those edges, not shotgun everything. So now we're going to put the tourniquet on. And what this will do is going to squeeze the blood out of your toe. Once we squeeze all the blood out of there, you can see we're already in wrapping here. And then that'll keep the blood out of your toe and give us a better, cleaner feel so we can make sure we're getting all the edges out of there, we're not leaving anything in there. And also, again, we can use less chemical, and it has a better success rate. I think because you can see it a little bit better.